Sawadika and good morning all participants. My name is Dr. Rangsiya Narin, a lecturer from Department of Public Health, Nursing Division, Chiang Mai University. This is the role and function of public health personnel in providing services for the community session here from the Faculty of Nursing Studio, Chiang Mai University, Thailand. First of all, I would like to talk about the contents that I'm gonna share you today. I will start with briefing of the Thailand COVID-19 situation updates, and then I'm gonna talk about role and function of public health personnel in Thailand during the COVID-19 pandemic. Next, I will show you lessons learned from Happiness Sharing Volunteer, the Strengthen and Sustainability Community from Lamphun Province. After that, we have a roundtable discussion with the representative from the community. And lastly, I will summary this session. So now, let's start with the COVID-19 situation updates in Thailand. Since the COVID-19 outbreak was confirmed in Thailand in 13th of January, at that time when the deadly virus was barely understood and seemed like a likely backdrop for massive infection and mortality, surveillance among incoming travelers revealed a small number of cases throughout January, almost all of whom were visitors or residents returning from China. The first report, local transmission, was confirmed on 31st of January in Thailand. At that time, the Department of Disease Control, or DDC, from Ministry of Public Health has been implementing its surveillance protocol by fever screening of travelers from all direct flights from Wuhan, China to the international airports. And then the protocol has been applied to international and domestic airport, seaport, and also carport. On 22 of January, DDC scaled up the Emergency Operations Center to Level 3 to closely monitor the ongoing situation both at the national and international level. Surveillance and preparedness to respond to emerging infectious disease have been enhanced in the government and private hospital, an area of tourist attraction. On 23rd of January, the travel alert for the coronavirus outbreak was raised to level 3, and then the Ministry of Public Health recommended that the travelers avoid all non-essential travel to outbreak areas such as Phuket, Chiang Mai, Bangkok. And then in February, a meeting of the National Committee for Emerging Infectious Disease Preparedness, Prevention and Response was convened by the Prime Minister. He has instructed all relevant agencies and all provinces to take all comprehensive measures to prevent COVID-19 in every part of the country. All provinces in Thailand were requested to regularly report the result of their work, for example, the case, the action, the activity that every province take the action. And then on March, we have seen the number of cases increase rapidly in mid of March. This was attributed to several transmission clusters, the largest of which occurred at the Muay Thai fight at the Lumpini Boxing Stadium on 6th of March, and confirmed that case rose to over 100 per day over the following week. So, Thailand restriction as the crisis and all business were ordered to close in Bangkok and also in some provinces, including Chiang Mai, Phuket, and Chonburi. So, the Prime Minister declared a state of emergency effective on 36th of March, and a curfew has been in effect since 3rd of April. Centralized management of the crisis and phases in hard we call lockdown measures by the National Security Council. A curfew imposed from 8 p.m. to 4 a.m. in the morning in order to limit the spread, and allow bureaucrats and medical professionals to command, lead and communicate by the Thai government's response. So at that time, we have order to work from home and stay at home because of the public venue, the business were ordered to close in several provinces. After Thailand say shut down, the abrupt closure of the Bangkok business prompted tens of thousands of workers to travel to their hometown. It's risking further spread and reflecting the failure among agencies to coordinate a unified response. The government was sharply criticized for various aspects of its initial response to the crisis. Criticism was aimed at the government's inconsistent policy over international travel and quarantine requirements, indecisiveness and slowness to act, and also they have poor communication. So that's why these shortcomings were partly addressed with the establishment of the Center for COVID-19 Situation Administration, or we call CCSA, as the Central Response Center under the state of emergency, with all public communication directed through its spokesperson, Dr. Tavisin Visnuyotin. The CCSA also have English version by spokesman Natapanu Nopakun. He is the Deputy Director General of Department of Information and Deputy Spokesman Ministry of Foreign Affairs. You can follow the CCSA announcement every day from the website and also from various platforms. So I can say that so far, Thailand has seen a sharp drop in the number of cases with a single number since from April. Here is the infographic from the WHO and CCSA website. The data of the COVID-19 situation on the 17th of June, you can find the details that no new cases of laboratory confirmed. The total number of the cases reported in Thailand currently 3,125 cases. Of these cases, about 95% or around 2,996 have recovered. 2% of 58 cases have died and 3% are receiving treatment in the hospital. So this slide can show you after months battling the virus with no new infection cases, the government is now trying to reopen up by lifting its 2 months long nighttime curfew as long as they follow the social distancing. So the Thai government have many phases for reopening the establishment. If you're looking at the infographic here, you can see that the Thai government is now trying to relieve of lockdown measure. At the CCSA also announced a guideline for provincial administrative organization to initiate and implement the policy for establishment reopen. At the infographic here, you can see that we have the phase 1 for reopen. The phase 1 starts from the 3rd of May, reopen the markets, restaurant, retail wholesale, and also barbershop, for example. After that, we open that phase, and then we try to looking for 14 days to evaluate the effectiveness of the measure. And then if we see that they have low number or they don't have the case pop up in the data, so they start to reopen again for second phase. On the second phase from 13th of May, for the activity such as the gym or the healthcare activity will reopen. So it means that some activity that related to economy and the way of life and that curfew time was changed from 8 p.m. to 11 p.m. After that phase, we go to phase 3 or third phase that start from 1st of June for certain business and activity such as department store, cinema, massage and spa house. And now the Royal Thai government is lifting its 2-month-long nighttime curfew. As I said, this is the fourth phase, start from Monday 15th of June. It means that since we have reopened, this means people are allowed to go out for shopping, dining, studying, go to the pub, bar, karaoke as long as they follow with social distancing rule as a customer new normal or new normal era. So this infographic can show you the campaign Customer New Normal in Thailand. So it means that the customer new normal need to following the basic step before going out, such as wear mask protection or wear protective equipment like face shield, wash hand often with alcohol-based hand sanitizer gel, and also following the basic guideline for visiting store. Thailand also have the developed the Chana application. If you're looking at the slide here, you can see that the people can scanning the QR code and can register this platform, which available on Android and iOS to contract tracing the moving route of confirmed patient who got the coronavirus. So the result from the first start on May, you can see that the implement of the platform show a good cooperation from the business establishment and the public. However, now we have the statistic that the number of people using Chana may be decreasing a little bit. So the government hopes that Thai people will continue to use the Chana. As more establishments reopen, this also come to high risk of the COVID-19 too. Continue to use will be the important tools to prevent the second wave of the COVID-19. And now this application will update for the group check-in, which are easier to use of this application. As the user, they are concerned about the privacy. The platform also confirmed that it serves for purpose only health and to control the pandemic situation. They of course not to track in the activity or use of data aside from the infection of the COVID. So if the people who infected COVID, so those people who use this platform will notify effectively. Now I'm gonna moving to the role and function of public health personnel in providing services for the community during the COVID-19 situation in Thailand. As Thai have public health personnel comprise majority of the Thai healthcare system, they are at the front line of any outbreak response and as such are exposed to the virus and put them risk of infection. In terms of occupational and safety and also health hazard include pathogen exposure, virus exposure, working out, stress, fatigue, burnout, stigma, and also psychological violence. So the WHO announced the right, roles, and responsibility of public health personnel as follows. First, assume overall responsibility to ensure that all necessary preventive and protective measures are taken to minimize occupational safety and health risks. Provide information, instruction, and training on occupational safety and health, including refresher training on infection prevention and control or IPC, use, putting on, taking off, and disposal of personal protective equipment or PPE. Provide adequate IPC and PPE supply in sufficient quantity to those caring for suspected or confirmed COVID-19 patients, such that workers do not incur expense for occupational safety and health requirements. So this slide shows you they have a lot of refresher training with the PPC training. They also talking about the right role and responsibility that the healthcare worker need the familiarized personnel with technical updates on COVID-19, provide the appropriate tools to assess, triage, or test and treat patients, and to share infection prevention and control information with the patients, and to share IPC information with patients and the public. Provide appropriate security measures as needed for personal safety. Provide a blame-free environment in which health workers can report on incidents such as exposure to blood or bodily fluid from the respiratory system, or to cases of violence, and to adopt measures for immediate follow-up, including support to victims. Next is advise public health personnel on self-assessment symptom reporting and staying home when ill, maintain appropriate working hours with breaks, consult with public health personnel on occupational safety and health aspects of their work, and notify the labor inspectorate of cases of occupational disease. Allow public health personnel to exercise the right to remove themselves from a work situation that they have reasonable justification to believe present and imminent a serious danger to their life or health, and protect public health personnel exercising the right from any undue consequence. This also not require a public health personnel to return to a work situation where there has been a serious danger to life or health until any necessary remedial action has been taken. Honor the right to compensation, rehabilitation, and curative services if infected with COVID-19 following exposure in the workplace. This would be considered occupational exposure, and resulting illness would be considered an occupational disease. And lastly, provide access to mental health and counseling resources, and enable cooperation between the management and public health personnel, workers, and all their representatives. They also give suggestion that the public health personnel should follow established occupational safety and health procedure, avoid exposing others to health and safety risks, and participate in employer-provided occupational safety and health training. Use providing protocol to assess, triage, or treat the patient with respect, compassion, and dignity. Maintain patient confidentially. Swiftly follow established public health reporting procedure of suspect and confirmed case. Provide or reinforce accurate infection prevention and control and public health information, including concern people who have neither symptoms nor risk. And put on, use, or take off and disposal of personal protective equipment properly. Self-monitoring of signs of illness, and self-isolate or report illness to manager if it occurs. Advise management if they are experiencing signs of undue stress or mental health challenge that require support intervention, and report to their immediate supervisor any situation which they have less reasonable justification to present an imminent and serious danger to life or health. So, in terms of occupational and safety and also health hazards mentioned by the WHO announcement for generalized public health personnel to follow with the right laws and responsibility. But the question still coming up, how public health personnel provide the services for the community, in particular in Thailand, because Thailand can coping this situation quite well. I can say that public health personnel comprise a majority of healthcare system. As in other developing countries, they are at the front line of any outbreak response. Health promotion and risk reduction among public health personnel, particularly in the community rural area, is an important function of the health services. So the public health personnel in the community have the critical roles to play in the primary care system by providing essential intervention and health services, such as advice for wearing personal protective equipment or PPE and performing screening and detection of COVID-19 for those who are in self-quarantine at home. This slide also shows you the community health nurse and public health officer. They have the fever screening at ground port, collaboration with other officers such as the provincial administrative organization, local government, police officer, and also community leader. Anyway, in Thailand, we have another kind of the volunteer called village health volunteer. Village health volunteer, we can say that they are the health personnel that very played a major role and considered as an important mechanism in Thailand's robust primary healthcare system, especially in rural areas where access to medical care is limited. So, Thai have a village healthcare volunteer, 1 million in nationwide, where they're stationed in every village in the country. Each volunteer takes responsibility around 10 to 15 households, and village healthcare volunteer trained by the public health personnel such as community health nursing or public health officer. Once they train the village health volunteer, so the village health volunteer can provide the services like screening or give education to the people in the community. So the village healthcare volunteer who work in the front line with the medical personnel in rural and also in local area who recognized by the WHO organization. The work of the village health volunteer that we hope to strengthen further. Since 15th of April, the village health volunteer have visited around 1.8 million households to provide knowledge about COVID and preventive measures. The volunteers are the great tool for deliver information because they often more familiar with the community as well as to follow up on the possible cases infection. Not just only that, the village health volunteer also can deliver the medication. For example, the medication for the people who got non-communicable disease. They can regular visit to check on the people health, track any cases and make sure that who might be infected to self-quarantine at home. They also give the information or educate the people who have health condition at home and also provide the protective gear such as mask or alcohol gel which they can provide as they need. So the healthcare volunteer can teach the villagers about the coronavirus and make sure that they follow the government instruction. So the healthcare volunteer still provide the education by knocking people at door and remind the people to wash their hands and to maintain the social distancing in public area. Not only the village healthcare volunteer who play the major role for providing health services to the people in the community. Next, we're gonna show you the Umong community, Lamphun province. They also have another kind of volunteer that I call sharing happiness volunteer to provide the services alongside the public health personnel in the community. So, see next. Next, I'm gonna move to the lesson learned from Umong community, Lamphun province, Thailand. Before we have the video, I would like to share the background of the community a little bit. Umong community is a sub-district in Mueang district, Lamphun province. They have a population around 15,000 at this moment, and the Umong community is a such community which found strengthened to playing the role in solving problems during the COVID-19. They use the community engagement as a key success as a process of working collaboratively with a group of people and organizations inside and outside community. As I said, they use the community engagement. We know that the community engagement an increasingly effective strategy for harnessing community potential, particularly in health improvement. CE has been widely used by the health interventionists to engage communities in health promotion, research, and policy making to address health issues. The Umong community have engagement by the Chiang Mai University and also Faculty of Nursing. As far as I'm in the field of community nursing, and I also make the research in the community, so that's why I have the big collaboration with them for many years ago. In the field of community nursing research, from Faculty of Nursing, we have launching, teaching, research, community services, and other academic activities in rural and urban areas. In particularly, we launching the community participatory research to promote academic services and societal engagement and engage and academic services strategy with the Umong community. One of my group that I'm working with is happiness sharing volunteer called Asa Pansuk. Asa Pansuk now have the member around 250. At first and second year of establish, the member need to pay a little bit of money to be the member, but now recently it's free of charge because they have whole funding support from Umong municipality, local government, and also almost of their funding support is from donation box called 1 baht 1 meeting, and also they sell out the coupon ticket at the village festival that held once a year called Wine and Sausage Festival. So before they have the COVID-19, this is their main activity: annual meeting, provide home visit, join village activity, and launch the donation activity. So this is some of picture to show you the annual activity and training. You can see that some activity I'm working with the student from Faculty of Nursing. They can provide home visit with my student and provide a lot of activity. However, during the COVID-19 situation, they change a lot and they have the paradigm shift for caring. Let's see the video.